Welcome to the very important Physicians and Kids presentation on community and systems advocacy brought to you by the Coordinating Center and our partners, the Parents Place in Maryland and Public Policy Partners. For those of you who are unfamiliar with VIP Physicians and Kids, we are a patient-centered medical home program at the Coordinating Center, funded by the Maryland Department of Health's Office for Genetics and People with Special Healthcare Needs and the Maryland Community Health Resources Commission. We partner with pediatric practices in Maryland to coordinate care for children and youth with special healthcare needs. Providing effective care coordination can be challenging and complex, especially for children and youth with special healthcare needs who receive care from numerous providers and systems. That is why we partner with providers, the patient, and their family to deliver a collaborative self-management care coordination model. Participants can expect our experienced community health workers and RN care coordinators to help them address barriers in care, develop a shared care plan, and find resources that best fit your family's needs. This presentation will prepare families for current and future advocacy needs. Our objectives are to provide you with an understanding of the different types of advocacy and the impact it can have on your child and community, and an advocacy framework with tips and tools for building effective systems of care for your child and other children and youth with special healthcare needs in the community. First, you will hear from Renee Everett-Sanzone, the Executive Director of the Parents Place of Maryland, who will talk about community advocacy versus systems advocacy, followed by some tips for families who plan to serve on advocacy groups and/or committees or boards of mission-driven organizations. Then you will hear from Robin Elliott, a partner with Public Policy Partners, who has over 15 years of experience in legislation, the state budget process, and healthcare finance.
As parents of children with special healthcare needs, you know your child best. You are their strongest advocate. Here at the Parents Place of Maryland, we support and empower parents year-round to make and affect change at a community and systems level. Today you're going to learn how sharing your lived experiences and personal stories, as well as investing in skills development, can make you an even stronger advocate. There are two types of advocacy where you can make a difference. The first is community. Community advocacy is personal. It's about defining your community and figuring out how you can make a difference in your personal community. When you think about your personal community, think about where you live and what opportunities there are for involvement. Personal community can mean your city or town, your local school system, or even your religious community. And as you probably know, there are multiple opportunities to get involved in your local community. You can serve on the local transition council or local care team, a disability agency board, or an advisory committee, or something else. The second type of advocacy is systems advocacy. Systems advocacy is where policy is developed and implemented. It's also where financial investments are made. Systems advocates can affect change at a state or federal level. You don't have to be a professional advocate to affect change at the systems level. Some examples of how you can engage in systems advocacy include joining a consumer group that reviews and looks at changing policies, a commission that advises a state agency, or a council that advises an organization or nonprofit board. A major benefit to systems advocacy is that you can help make a difference for other children with special healthcare needs. You can also help increase funding for programs and services. This form of advocacy includes using your voice to testify on an issue and establishing relationships with your elected officials. Now that you understand there are two types of advocacy, community and systems advocacy, the next step is figuring out how you can take your passion and knowledge and use it as a powerhouse for change. You do this by serving. However, we know that choosing when and where to use your voice can be overwhelming with countless opportunities to choose from. And the fact is, you have limited time available. There are many different types of groups. There are boards, task force, committees, advisory groups, work groups, evaluation groups, and many more. So where do you start? You start with identifying what issues are most important to you. Then you need to ask yourself, do I want to make a difference in my personal community or at a systems level? Or both? Think about the needs of your own child. What are the gaps in care that they and you have experienced? What types of change are you most interested in? You can then marry your personal advocacy experience, your personal knowledge, with the issues you want to address, your passion, to find the group or groups that will help make a difference, make a change at a community or systems level. Before you start any sort of advocacy effort, you need to go over a checklist. Do you have the time? Seriously, we must ask ourselves this question. In the next slide, we will go over a tool that can help assess if you have the time to take on a new opportunity. So many times, we as family members care so deeply and want to make things better for all of our families that we tend to say yes when maybe we should say no. Now, if you do have the time, you need to prioritize which group and which requests are most important to you. Lastly, you need to learn the skills needed to serve on groups so that you have the opportunity to make the biggest impact to truly affect change and make things better for families. It isn't enough to just be a family member and have passion. Those are important. It is the fire in the belly. It is the lived experience that probably no one or very few sitting around the table bring. The skills help us harness all that passion and all of that power. In the slide before, we asked the question, do you have time? Not meaning to be funny at all, but sometimes it's hard to answer this question. This tool is one we have used at Parents Place of Maryland to help prepare families for serving on advocacy groups. This tool is meant to help you identify what's on your plate and help you prioritize your commitments. As you can see, the horizontal arrow shows high time and low time. The vertical arrow shows high time and low energy. To start, grab a piece of paper and draw these two lines. Now think about everything you're currently doing with groups. Write down each of your commitments and think about how much time and energy it takes for each. One by one, does the group require a great deal of your time or very little? Is it requiring a lot of your energy or very little? Now, ask yourself these questions for every group you're involved in, including groups that are not related to special health care needs or disabilities. For each group, write them down in the quadrant they fall in. If the group that is high time and high energy, it's going to be in that top right corner. If it is a group that is high time and low energy, it's going to be in that bottom right corner, and so on and so forth. Once you have finished, look at the chart. This should let you know quickly, do you have the time? If you have the time, say yes. If you don't have the time, but the request to join the group is important to you, then maybe look at what you're currently doing and adjust. Give something up or shift the amount of time and energy you are investing in something else. This is a nice way of giving you a visual representation of all the work you are doing related to advocacy work. It is one thing to be passionate about making a difference and getting involved. It is admirable, and we definitely need the family voice. We are the ones using the service, so we should be at the table to make sure our voice and voices of others are heard. But we really do need to learn the skills so that all of our passion is really moving forward towards a change that makes things better for all the children with special healthcare needs. As I mentioned earlier, there are many different types of groups. You have to figure out which group is the best fit for you with your time, your interest, and passion. A committee, a task force, a board, an advisory group, for example, and then you need to understand the functions of the group. How often does the group meet? How is it run? Telling your story. This is a balancing act. Our story is always important, but when you are serving on a group, our story is to move the work forward or the issue forward, and it should be used to lift up all family voices who are experiencing the same issue or dilemma. It isn't only about our own situation. Telling your story is an impactful way and useful skill to learn. Last, but certainly not least, is data. When we do this work, emotions are important. It is the passion and heart of the work, but decisions need to be based on data. Data is critical to assisting our work with children. Timely and accurate data can be one of the most important tools as it can make a case more persuasive. To assist you in this endeavor to find and use data you want or need, use the three-step process. First, define your purpose. Why do you need data? This can be to illustrate a need, to reduce uncertainty, to inform public opinion, or to prove to others what you already know in your day-to-day experiences. Based on your purpose, what data do you actually need? Do you need people data, age, race, gender, events data, births, deaths, or things data, places and organizations? Step 2. Find the data. Start your search with the Census Bureau. The Census Bureau is a source for social, demographic, economic information. Census data is used every 10 years for distribution of representatives among the states, but is also used for many other policy purposes. Some other resources are the American Fact Finder, FedStats, FirstGov, and the Ann E. Casey Foundation. Even a university. Universities can be an excellent source of data for you. Contact a nearby university and ask their university for their research bureau. Step 3 is to explain the data. To understand the data, you need to present it in a form that best presents your case. Remember, the visual is more powerful than the audio. As you calculate the figures, put them in charts or maps to show trends, progress, patterns, or differences. When explaining your data, do the basics. You do not need to be a statistician. Data can be a powerful tool in your efforts for advocacy. Take the time to explore the data sources available to you and practice using data to make your advocacy even more compelling. This just scratches the surface about advocacy and the skills to effectively serve on groups.
Hello, my name is Robin Elliott. I'm very excited to be with you today because I am a systems advocate. And it is really important for my work to work with families and individuals just like you. You make the difference. Systems advocacy at the core is about translating personal experience to system-wide change, whether that is within a neighborhood, a city, a county, a state, or even on a national level. So I'm very pleased that you're joining us today. You can do systems advocacy in really 6 steps that we're going to talk about today. I wanted to let you know that I have really seen countless times individuals make a difference. I know this sounds cliche, but it's really true. And I'm going to share just one example with you. I worked with a young man who, as an adolescent, was experiencing many health issues that his education system didn't pay for, so he needed his insurance for his occupational therapy, his speech therapy, and his physical therapy. But insurance coverage didn't work very well, and he was very frustrated, and he saw how it affected him. So when he was a little bit older, he went and talked to legislators, other advocacy groups, individual advocates like himself, and in the end, he inspired a groundbreaking bill which has improved insurance coverage for everyone in Maryland. That advocate is now a paid advocate in Washington, D.C. So advocacy can be a path as a volunteer, or it can be potentially a career. Whatever your pathway, I'm glad you're here today. The first things you'll want to do is select an issue and prioritize. This sounds simple, but I know it's not. From personal experience, there's so many things that you want to change in this world, but we don't have time, or at least I know I don't. So select 1 or 2 and then start thinking about what are the solutions. These solutions can come from your personal experience. They can come from recommendations of other organizations, or all of the above. But at the core, ground everything with your personal story. In the end, it's your personal experience that is really going to make a difference in your advocacy journey. Step 2, you may want to think about teaming up with an organization. Organizations have more resources than many of us as individuals, and they can really help move the needle on a policy issue. First, of course, you want to make sure that that organization aligns with your mission and your vision. You also probably want to look at, are they open to consumer participation? There are ways to tell. Does that organization have a newsletter which talks about individuals advocating? Does it have a policy committee? Events that can be participatory that feature policy issues? You can check it out. You can join a newsletter or attend an event or volunteer. You don't have to decide all at once. You can look at an organization and decide as you go along if it's the right fit. And of course, identifying the decision makers. These are your state officials, your county officials, even your legislators. If you live in Maryland and you need to know who your legislators are, you can go on the website right on the screen, www.mdelect.net. Type it in, type your address, and you'll get the whole list. Finding those legislators and then determining where they are in the issues that matter to you. You can research them, you can look at their website, you can look at other organizations. And then the other thing I would suggest is find out a little bit about them personally. Sometimes those personal connections are really what matters the most. Do you share a school? Do you share a gym? Do you go to the same grocery store? Do you have some mutual friends? All of these things are important. And then find an opportunity to connect to that legislator. It could be in person or virtually. There are many opportunities. There are town halls. Many legislators also enjoy one-on-one meetings with their constituents. And then think a little bit about the legislative process. This doesn't mean that you have to be an expert, especially starting out. It is definitely learn as you go. There are two core processes, whether you're working on a local level, a state level, even a national level. You have a budget process, sometimes called an appropriations process, and then a policy or bill process. Each of these processes have separate committees that make those decisions. So just like you're going to find out a little bit about your own legislator from your district, find out a little bit about the people in charge of those committees. What makes them tick? What are their stances? Step 5, communicating your views. This can be challenging, especially when you first start off. Know going in that you seldom have a long period of time to meet with an official or a legislator. So being organized and even practicing ahead helps. We have a couple tips for you. Start off by identifying yourself. And if it's a legislator, identify your neighborhood or somehow indicate to them that you are a voter, you are a constituent. Always state your purpose. You want to state that right up front so they know what to expect and what to listen for. Also know going in that they may not be an expert in this issue. Legislators, such as in Maryland, sometimes deal with 2,500 bills a year. There's no way they can understand all the ins and outs. They really rely on others to share their expertise. Always weave in your personal story. This is really the cement, the glue, the thing that people remember when they leave a meeting. Facts and figures are important, but that personal story really will motivate them to change the system. Know that you might have to be very brief. Of course, always thank them at the end. They will thank you. Everyone's time is valuable. And probably the most important thing is to create an opportunity for follow-up. Advocacy is seldom done in one meeting. It is over time. So whether it is that you're going to get back to them with more information, you're going to let them know about what happened at a community meeting, or even setting up a follow-up meeting. Whatever it is, create that second opportunity, that third opportunity to interact with them. A couple suggestions, especially if you live in Maryland. The organizations that I've featured on this slide here, the Coordinating Center, the Parents' Place, all very active in Maryland. If these organizations are the right fit, they may be the organizations you want to team up with in your advocacy journey. Follow them on social media, join their mailing lists, send them your stories. And I wanted to flag one of the best, most exciting advocacy events all year in Annapolis, and that is the Maryland Developmental Disabilities Day. This has been time and time again one of the most effective advocacy events I've ever seen. It has moved bills to the finish line repeatedly. So it's a really exciting way to start off your advocacy journey. And no matter what path you take, I hope our paths cross one day. Thank you.